International Day to End Obstetric Fistula is commemorated every year on May 23rd. This event aims and strives to diminish and eradicate the case. Be that as it may, countless women in Tigray have been subjected to this case due to the recent war and are suffering immensely.
I was exposed to obstetric fistula during birth. No medical care or ambulances were available due to the war at the time, and so I birthed in the streets. I had gone through endless suffering after I returned home. I then went to Aksum and underwent a surgery, but I couldn't recover, so I came here.
When the enemy approached, we fled. I then gave birth on the woods. The Eritrean troops were everywhere, so I couldn't get any medication. Even after I had encountered the obstetric fistula, I couldn't come to Mekelle to get medication due to the war. I had spent 4 months of pain and misery. I came here after the peace agreement and my condition had worsened by then.
Obstetric fistula prevention specialist of Mekelle Hamlin Fistula Center, Almas Ta'ammer, says the hospital has been able to prevent the obstetric fistula and diminish it to below than 1%.
በዓለም ደረጃ የፊስቱላ ቀን ተብሎ ይከበራል።
The day is commemorated as the Day of Ending Obstetric Fistula internationally. It had been commemorated regionally as well. Even in our region before breakout of the war, we had been able to prevent the case and diminish it to below than 1%.
The nurse explains the current case of obstetric fistula has gone back to how it was 15 years ago. She adds many among the patients in the center were exposed to the case either due to sexual abuse or due to lack of access to medical services.
አሁን ደግሞ በዚህ 3 ዓመት ባጋጠመን ጦርነት ምክንያት
Due to the war that broke out in 2021, the number of patients who undergo home labors due to the lack of medical access and sexual survivors has consistently increased. As a result, the current number of obstetric fistula patients is equivalent to that of 15 years ago. The case is rising in our region consistently.
The patients urged the concerned bodies to work on restoration of all destroyed health centers and facilities, as well as resumption of ambulance services.
All of the destroyed health facilities and ambulance services must be restored.
Health facilities must be restored in order to prevent this from happening again on other women, especially the places that are still under occupation of foreign forces need special attention. Countless women are suffering enclosed in their homes.
ከ80% የጤና ተቋሞቻችን ፈርሰዋል።
Over 80% of our health facilities have been destroyed due to the war. Restoration of health facilities and well-being of mothers and women must be ensured. Women who undergo home labors must access adequate medical care.